one of the other things that people are seeing is that, they were told that this would be a 2, maybe a 3 shot, and then dose vaccine, and then things would go back to normal.
End this pandemic once and for all. Everyone wants that. And we know the way to do that is to get as many people vaccinated as quickly as possible.
And here we are in lockdown again. And I think that really caused a lot of folks to say, this doesn't make a lot of sense, and maybe I'm going to wait this one out. I think that's what could be happening. Now, to the second part of your question, I think it would, well, what would it look like if people left parents alone to make the decision? Well, I don't think we'd be talking about vaccines every day. I don't think that they would be trying to mandate them for schools. I think public health, like any other infectious disease that we vaccinate against, would make the products available, put the information out there, be there if parents had questions, and that's it. And we'd go back to normal.
Warning, censorship. Warning, censorship.
Tamara Ugolini here for Rebel News, and in today's interview, I am bringing you independent financial investor and self-proclaimed accidental and unofficial COVID-19 data analyst, Kelly Brown. In October 2021, I interviewed Kelly about the speech that he delivered to the Toronto Board of Health using raw public health data that showed a concerning incidence rate and upwards trend of post-vaccination myocarditis. Bear in mind that that was a few months ago, and Kelly will share updated data in this interview. But at the time, and with Kelly's help, I pointed some great questions to Toronto Public Health, a health unit which is overseen by Dr. Eileen Davila.
Defining what drugs are legal and what drugs are not is not actually based on the risk of harm.
Who is Toronto's Chief Medical Officer of Health. She not only leads Toronto Public Health, but she also advises the Toronto Board of Health, which directs and oversees the work of Toronto Public Health. The Toronto Board of Health determines and sets public health policy and advises Toronto City Council on a broad range of health issues, among other things. And in order to view this report in its entirety, because we question the science enforced by the Ministry of Truth, you will have to scroll down to the description below and click the link there to be redirected to the full report. I will see you over there.